उदयपुर में इंडियन मेडिकल एसोसिएशन के सहयोग से महात्मा गांधी मेडिकल एंड हॉस्पिटल जयपुर द्वारा डॉक्टर्स कॉन्फ्रेंस आयोजित की गई, जिसमें मुख्य लिवर प्रत्यारोपण सर्जन डॉक्टर नेमिश मेहता ने लिवर रोगों और लिवर प्रत्यारोपण पर व्याख्यान दिया। उन्होंने कहा कि देश में लाखों लोगों को लिवर प्रत्यारोपण की आवश्यकता है, किंतु पिछले साल मात्र करीब 4000 ही ट्रांसप्लांट करा सके। इसकी मुख्य वजह डोनर का अभाव होता है। अंगदान के लिए परिवारजनों को आगे आकर लिवर का एक हिस्सा दान करना चाहिए, जिसके ट्रांसप्लांट से रोगी की जान बचाई जा सके। महात्मा गांधी मेडिकल कॉलेज और ट्रांसप्लांट, आपको बता दें कि अस्पताल राजस्थान राज्य का पहला निजी संस्थान बन गया है, जिसके पास शराब जनित लिवर रोगों से लेकर लिवर प्रत्यारोपण की बढ़ती आवश्यकता को पूरा करने के लिए एक समर्पित इन हाउस सर्जिकल और मेडिकल टीम है। वहीं इस दौरान महात्मा गांधी मेडिकल यूनिवर्सिटी के चेयरमैन डॉक्टर विकास चंद्र स्वर्णाकर ने कहा कि महात्मा गांधी अस्पताल में 1500 से अधिक लिवर प्रत्यारोपण कर चुके हैं। अनुभवी डॉक्टर्स की टीम है। शीघ्र ही ये 200 करोड़ की लागत से लिवर तथा पेट संबंधित बीमारियों का विश्व स्तरीय केंद्र बनाया जाएगा। संस्थान में विशेषज्ञ सर्जन, हेपेटोलॉजिस्ट, ट्रांसप्लांट, एनेस्थेटिस्ट और तथा गहन चिकित्सा विशेषज्ञों की समर्पित टीम है। कॉन्फ्रेंस में हेपेटोलॉजी विभागाध्यक्ष डॉक्टर विवेकानंद सरस्वती ने बताया कि जयपुर में अधिकांश प्रत्यारोपण लिविंग डोनर लिवर प्रत्यारोपण है। कार्यक्रम में आईएमए पदाधिकारी डॉक्टर आनंद गुप्ता तथा डॉक्टर प्रशांत अग्रवाल प्रमुख सहयोगी रहे।
Eventually, we intend to move towards minimally invasive donor hepatectomy. The idea and the motto of Mahatma Gandhi Medical College and Hospital is we try to continue to provide affordable liver transplant procedure. Healthcare is, yes, it is a state affair, but even the state has done its bit. As an institute, we are doing our bit when we are doing the transplant in the Chiranjeevi as well as the RGHS scheme, which is cashless. Looking at the vision of our institute, Dr. M.L. Swarankar and Dr. Vikas, they both.
Thank you, Dr. Naimish, for a wonderful and enlightening presentation as usual. And we are very fortunate to have him with us as a part of a very competent and dedicated team. I thank the IMA Udaipur branch, Dr. Anand Gupta, President, Dr. Prashant Agrawal, Secretary, Dr. Nishant Ashwani, and their able and competent team of IMA office bearers of Udaipur for giving us this opportunity to organize the liver transplant and hepatology CME at Udaipur. Dr. Chaparwal, Senior Doctor and Vice Chancellor, sitting in the audience, Dr. Vipin Mathur, Senior Professor in Gastroenterology and Principal of R&T Medical College Udaipur, and other dignitaries and eminent doctors in the audience. I thank you all for sparing your valuable time from your busy schedule to grace the CME program. Support of colleagues is as important as having a competent team. Living donor liver transplant surgery is one of the most challenging surgical procedures in modern medicine, as we all know. Not only the surgery, the pre-operative period when the patient is wheeled in for evaluation and workup and all the morbidity he brings along, the operative period, which itself is very complex, challenging, and sometimes lasts 12 to 24 hours, and the post-operative recovery in a very highly sterile environment in the liver transplant ICU. All of this require a lot of logistics and management support. We as management of Mahatma Gandhi Hospital are sincere and committed towards ensuring that our surgical and medical team members led by Dr. Naimish Mehta can operate in an environment that is at par with the best centers in the country and globally, and deliver the best possible results in both pediatric and adult patients, in both acute and chronic liver failure patients. The center, as Dr. Naimish has performed close to 70 liver transplant surgeries, including living donor and the deceased donor. We try our best to make sure that the state-of-art infrastructure for GI, hepatopancreatobiliary, and liver transplant is available alongside having a competent team across all levels, that is medical, surgical, nursing, paramedical and administrative. The NMC approved DM and MCH training programs in GI surgery, HPV surgery, hepatology and medical gastroenterology further complements our endeavor in patient care and teaching and training of the coming generation of surgeons and physicians. We seek your active support and guidance in taking the program forward so that patients may benefit not only from Rajasthan but also from the adjoining areas and the country. Patients don't have to travel to Chennai now or to Delhi for donor liver transplant, and it is very much within the reach of a common ordinary citizen from the state. We cater to patients with government schemes like the Chiranjeevi Yojana, the RGHS, the cash patients and the TPA patients. Please feel free to reach out to me or anyone from my team in case any one of you feel that your patients are having any sort of difficulty. I thank you once again for your valuable time. It was a pleasure to come to Udaipur and meet so many eminent and dignitaries and faculties from the medical field of Udaipur. Thank you so much once again for giving us this opportunity.